a moment to thank our sponsors for their generous support. And I have just a few housekeeping reminders to run through. Let's see. Just want to confirm that we have the deck up. Okay, great. So for our housekeeping items, if you've been with us for the past couple of days, these look familiar. We have we ask that you enter your questions into the Q&A box. And if you need closed captioning, that is also available. And if you are running into any technical difficulties, which might be an understatement at this time, please email the wonderful people at NPAF events at npaf.org, and we will respond and try to help. Again, we really appreciate your patience as we work through some of these technical difficulties. And so as we get started today, I just want to run through some of the things that we've been talking about over the past couple of days, and that is just how much health needs navigation. We've talked about the critical opportunity to introduce policies that support financial and social needs navigation services in our healthcare system. We've heard from health services researchers and members of the community about the mounting evidence that shows that needs navigation is a proven solution that addresses patients' and caregivers' unmet needs. And today, we turn our conversation to advocacy, specifically how you all, as advocates, can help others understand why health needs navigation. And what we're going to talk about today is really the heart of needs navigation. And you might be wondering, what is that exactly? The heart of needs navigation is people helping people. What we've been talking about these past couple of days really isn't a brand new concept. And I really like to think of needs navigation as the antidote to our current healthcare system. It's simple, it's human, it's person-centered. The fact of the matter is that when we're sick, we need help. And we need someone, not something, but someone to help guide us. And many of you here joining today are that someone for others. And for that reason, I think we have a compelling case or an important opportunity to together embed needs navigation as part of healthcare. So with that, we have fantastic sessions planned, including one shortly where you will hear from NPAF volunteers about the amazing work that they're doing in their communities. But before we begin our sessions, we'd like to announce the winner of the Donaguen Outstanding Volunteer Award. So this is a bittersweet moment for me. I met Donna 8 years ago at my first patient congress as a volunteer. She was actually the first person I met. And it was a privilege to know her, to have worked alongside her, to call her my friend. And I am proud to be part of honoring her legacy here. At this time, I'd like to turn it over to Alan Balch, CEO of Patient Advocate Foundation and National Patient Advocate Foundation, to present the first ever Donaguen Outstanding Volunteer Award.
Thank you, Melissa. Yes, it is truly my pleasure to announce our first recipient of the Donaguen Volunteer Award, Maureen Steward, who's joined us. As Melissa was alluding to, Donna was our former Grassroots Advocacy Director. She was a patient advocate who is truly passionate about people. It seemed like she met someone new every day, and she would talk about how amazing each of you truly are. It's particularly fitting that Steward is the inaugural recipient of the award named in Donna's honor, because Mo truly reflects Donna's empathetic spirit and the drive to always do more. In fact, Mo is constantly apologizing for not doing even more. Somebody on the MPF staff remarked that for some of us, there are 24 hours in a day. For Mo, there may be more, actually. Mo has been an MPF volunteer since 2013, and amongst her many accomplishments, she's part of the MPF's volunteer advisory group. She serves on the board of directors for the Epilepsy Foundation of West Virginia. She's a member of the National Quality Forum's EHR Care Coordination Committee and is part of many other groups. One thing that's really exciting and novel about this award is part of it, Mo will have the opportunity in 2022 to design and direct her own community outreach project in Snowshoe, West Virginia, and surrounding areas with support from the team at NPAF. And I know we're all excited to see what you will develop, Mo, and the impact it will have. So thank you, Mo, for all that you've done for patients nationwide. I'm honored to name you the winner, as chosen by your peers, of the Donaguen Outstanding Volunteer Award. And if we were all together, we would stand up and give you an ovation.
Thank you so much, Alan. And thank you, Melissa. I had what I thought was a really good speech planned for this. And as the universe does sometimes, I thought it was fitting to change that and just kind of throw it out and go off how I felt. I am incredibly humbled to receive this award. I didn't know Donna for very long, but you kind of didn't need to. That was what was so fantastic about her. I remember at a story slam, I was really nervous and I wanted to do something dynamic and I chickened out at the last minute. And Donna was there as a teammate, as a cheerleader, encouraging me to go make the biggest impact I possibly could. And that's a special memory that I cherish, and Donna was fantastic. So I'm incredibly, incredibly humbled. I'd like to thank everybody at NPAF and PAF for including me, giving me opportunities to elevate voices that need to be heard, especially in Appalachia. It's something I really care about. These are wonderful people who got me through a difficult time in my life when I had cancer and my daughter was suffering with really severe epilepsy. And thank you for giving me a way to pay it forward, because I do owe this community a lot. I'm so, so honored for that opportunity. I'd also like to congratulate Mary Stabile and Becky Barnes, who deserve this award probably even more than I do. And on that note, I spoke a little bit. Well, I got an email from Gwen Darian last night, and I had just honestly a really difficult morning medically in our house. It was really hard. And it made me think about what Gwen said in her email, which is, that's what's so great about a family of patient advocates. We're here to prop you up so that you can be better and get better to help the next family or person who might need to be propped up. And I just really was feeling that this morning. You all have given me a tangible way to make things better for my daughter with a very awful disease that I can't control. And that means the world to me. So thank you for that. Thank you for being my family, my friends. This award really should go to everybody. Susan, Ashton, Tony K, Mike. I couldn't possibly name you all. Julie Wallace, everybody deserves this award. Thank you. Thank you for being my family in advocacy.
Congratulations again, Mo. I'm getting a little emotional. I just want to congratulate you, congratulate the nominees like you did, Mary Stabile and Becky Barnes. You all, it's been such an honor to see you all, the whole entire volunteer network, take NPAF's person-centered mission and bring it to your communities. I'm in awe on all of you, and congratulations to you, Mo. We're excited to work with you in West Virginia.
Thank you.
And at this time, I am going to turn it over to my colleague and teammate, Ashley Freeman, who will be moderating our first panel with our fellow volunteers, including Mo Stewart. So Ashley, turn it over to you.
Yes, thank you so much, Melissa. I am so honored to moderate this panel today. It is the perfect session to follow the presentation of the Donaguen Volunteer Award. Donna was such a light to be around. She was fun, uplifting, and cared so deeply about her work and the volunteers that she partnered with to make it really happen. You know, the last email that I received from Donna was wishing me a happy birthday. And she told me that she had a gift for me and that she would give it to me the next time that she saw me. And unfortunately, she passed away a couple of weeks after that. So I never got to see her again, and I never got to get that gift. But honestly, I believe that that gift is the legacy that she left with all of us. And that legacy that she left comes through all of our MPAF volunteers, both new and veterans. And today I get the pleasure of highlighting the advocacy experiences of 3 of our amazing MPAF volunteers. So I would love to start it off with Michael. Tell us about yourself. Tell us your name, your location, and what type of advocacy work you do and why you do it.
Sure. Hi, everybody. My name is Mike Olex. I'm in Ashland, Virginia, which is just north of Richmond. I basically started doing this probably 6-7 years ago, and I want to concur with everybody with regards to Donna because she was the one who got me involved with everything with MPAF, honestly, though. So a lot of the things that I work on, especially, are with regards to drug pricing and drug availability to make sure that patients can get access to the different medications that they need and stuff. Personally, I'm dealing with multiple sclerosis in an aggressive form, and I've been through, at this point, though, 10 medications, honestly, though, trying to find something that works. So to me, it's really important, though, for people to basically get the care that they need and actually to be their own voice, to actually help and be their voice in the medical community and stuff like that, and not just take necessarily, what basically insurance says they're going to get. So that's why I do the work we do with NPAF, and I love working with these guys so much. So.
Perfect. Thank you so much, Michael. And now let's transition to Tony K. Same questions: name, location, what type of advocacy work do you do, and why do you do it?
Yeah, thank you for the opportunity. I'm Tony K Manskowa. I've been a volunteer with MPAF, I believe, since 2013. And I've been working, I'm based in Rochester, Minnesota, but I've been working in healthcare for the past 35 years. Currently, I work with cancer patients, and I'm a member of cancer research projects at this large academic center where I live. My interest in helping others goes back quite a number of years to where I had a younger brother who, when he was born, he's developmentally disabled. And I saw how my mom struggled, where back in the early 1970s, there wasn't a lot of support for families, and my parents were told to place him in an institution and forget about him and just walk away. But my parents couldn't do that. And why I'm bringing this up is because there was a law that was passed back in 1974. It's called the Federal Equal Educational Opportunities Act, that really started to change things for my family. My brother was 5 and I was a 3rd grader in elementary school. And we started to have a county social worker that came in and provided case management services for our family and really met the needs of what my parents were looking for at the time. So I could see how a federal law could change so much. And I didn't know the name of the law at the time, but I knew that I wanted to help others and be part of that. But another thing that stands out on why I want to help people is I had an opportunity to travel to Washington, D.C. when I was a teenager. And I was standing on the steps of the Supreme Court on the 10th anniversary of Roe v. Wade. And I'd never seen such a huge protest, to where that really stood out to me, because I knew if people came together, that change could happen. And so I've had a couple of females, be it a high school teacher, that county caseworker all those years back, that really served as role models for me And it led me into wanting to help people. And that's where I am today. I talk with thousands of cancer patients every year about the latest research that's going on and try and help them problem solve on if they're having insurance issues and all the things that PAF is able to help with. Every patient I talk to and their family are going to hear about Patient Advocate Foundation. So I'm very grateful to be connected with such wonderful organization and to be able to have that resource in my back pocket for patients and families. So that's why I started to want to help other people. And thank you for the opportunity to share that.
Yes, I love that, Tony K. Being able to see how that federal policy changed the life for your family. And you said, how can I make this change for others? I love that. And now to you, our award winner, Maureen, tell us about yourself.
Thank you, Ashley. I forgot to say, because I was so overcome with emotion, that I did my best here in West Virginia and got my Target couture. I couldn't do like the dress shout outs like Donna used to do on Facebook, but it's off the rack. I'm limited. And that was a beautiful opening about Donna. I'm Maureen Steward. I live in West Virginia, but I'm originally from California. I've lived here for about 10 years. And I got involved with NPAF in 2013. But prior to that, I had a background in healthcare. So I was a case manager for several years. And around 2016, I started really working in advocacy because my family suffered some losses due to lack of treatment, just because that was the culture. Not everybody had insurance, and you kind of only went to the doctor if something was really, really wrong. And something was really, really wrong. I lost my dad and my brother, and it happened really quickly. And so I think that Tony is right. When people come together, impactful changes can be made. And also I'm nosy, so I want to get into as much as I can. And I don't want to see that happen to another family. It doesn't have to.
I love that there's this commonality between all of you all's stories, of seeing the impact that you can make and wanting to go do that, wanting to make that step in order to do something. So for you all, specifically Tony K, how did you transition from, being that advocate for yourself, your family, to now branching out to the community level, and helping other people? What did that really look like?
So I'm a mom and a grandma. And sometimes you'll hear that saying of moms will do anything for their kids. And that really was what it came down to where my kids had significant health issues. They didn't have insurance. And I was working with cancer patients, trying to help them connect with insurance. And so once the Affordable Care Act passed, my kids had insurance. Things within my own family started to improve, and it gave me more energy and time to help others, because I don't want it, just as Mo mentioned, I don't want to see anyone struggle. No one should have to walk down the paths that we've been down. Things need to get better, and if we all come together, we can make that happen. So be it mom and grandma energy, maybe, but I think everybody that volunteers here can say the same thing.
I love that being your catalyst. And what about you, Michael? How did you go from advocating for yourself to now taking this to a larger level?
I think the major thing that hit me, honestly, is the fact that from two different capacities. Number one, I think what Tony was saying, honestly, with regards to realizing that you don't want this to happen for everybody else, and having to do the work. And I always like to joke about it in terms of the fact I'm originally from Jersey. So I'm good at basically hollering and yelling. Not doing it right now, obviously, but I'm good at hollering and yelling and getting the stuff that I need and stuff like that. But I see so many other people in the community with different chronic conditions and stuff like that, and they can't get the services that they need. And basically they can't get the services, they can't get the medications, they can't get the treatment, whatever it is. There's a lot of different avenues, and they don't even know where to start and where to reach out and things like that, though. So that's kind of how I did the transition. The other side of that is, I have a lot of education. I used to be, in charge of radiation at a major hospital. So I can argue and basically talk about science to someone left and right. But I realize, though, talking to different politicians, that basically, yeah, they're at my same level. They're not really this pie in the sky where they're sitting in their ivory tower. And that this is something that I can do because I know my story. I know basically what my community needs. And that's why I do this. And that's why I can fight for these things, to basically get things through that help just not just my community with the MS community, but help all the patients with chronic diseases, because I hate seeing people suffer. And I hate basically having to, basically go through the avenue of, okay, you're gonna have to go through XYZ to get to this. And let the patient work with the doctor, not necessarily have to be insurance moderating everything. So
What you said there was so powerful. I know my story and what my community needs. I think that is the mindset that all of our MPAF volunteers have, right? You know that your story is powerful. You know that you know the needs of your community, and you know how to then transition that into action. And so for all of our new volunteers who are just tuning in or just started working with MPAF, what are some advice that you would share with them in order for them to start getting involved in their communities? And anyone can jump at this and share.
I'll start, I guess. I think the major thing is be comfortable knowing who you are. I think is the fundamental thing. I think understanding and being comfortable, and not necessarily, the reason I say it that way is because I know when I was initially diagnosed, way so many years ago at this point, it's been about 20 years now, I was embarrassed by the multiple sclerosis. I felt like it was somehow my fault. And whatnot, though. So I didn't want to ask for help because somehow I felt like I brought it on myself. You need to be comfortable with yourself when you're talking to legislators, and not have a disconnect. You want to bring the emotional component, but you want to understand who you are, and you want to understand why you're there talking to them and asking for whatever it is for the different policy to help make a change for everybody and stuff like that. So like I said, I went through, I'm on my 10th medication with MS. And at the time, the initial medications when I was first diagnosed were about $30,000 a year, which, trust me, that's a big enough number already. But that same exact medication today is $90,000 a year. Yeah, exactly. That's a good eye raise. But my point though is, what caused the medication to go up? Did anything actually happen, or is it just greed? So my point is, I'm not embarrassed anymore that I'm having to take this expensive medication to help keep me somewhat ambulatory and whatnot, though. But at the same time, I want to basically communicate with them that this is not my fault. This is something that I need your help with, though, to make a change and make a difference. So, yeah.
Yeah, if I had to give some advice for new volunteers, it really is to believe in yourself. Because I had teachers, I had a lot of supervisors in my work area that believed in me. And that's where I think people that have been in advocacy work really need to come behind a new volunteer and just encourage them and say, this is possible. You can do this. I love being a mentor at work and helping someone learn something new. And there's a lot of excitement within the advocacy community, and you want new volunteers to catch some of that excitement to kind of fuel their journey, because really change is possible. Anybody can help in making change.
That support system is so important. And I mean, Mo even said it earlier about that experience where she wanted to chicken out. And Donna was like, no, you got this, you know, and I think that's the power of MPAF. We have a staff, we have a community of people who want to empower you to go share your story, to be comfortable in your journey, and to know your true power. So Maureen, I would love for you to share with us, what does being an MPAF volunteer mean to you? You know, and how do you share our campaigns and resources? Because in the intro, Alan said that you have more than 24 hours in a day. So I would love to hear what you are doing in your community.
Well, Appalachia in general is kind of its own microcosm of culture in America. So we don't approach issues the way I grew up approaching them. We have issues with connectivity. That's frequent. We also have the most elderly population in the United States per capita, and we have a really high illiteracy rate. So social media and things like that don't really work well here, but that's okay because I'm terrible with that stuff. So it's really person-to-person connection, and kind of like what Mike said, being comfortable with yourself and knowing your story. So it's important for me to remember that we're all in the same water, but we're not all in the same vessel. You know, some people have a rowboat, some people have a yacht. And so just really getting to really know people in my community and approaching them. And sometimes it's really intimate and personal because you know more about people in a small community. So I try to pester everybody about care planning. That's number one. But also, I don't have to work that hard. This is a wonderful, dynamic group of people who care about each other. And sometimes they just don't know how to start. So we have a pharmacy pool going on right now because our closest pharmacy is 2 hours away. So people are taking turns and picking up everyone's medicine, you know, so that's a huge 4 hours out of the day. That's a huge commitment. So, you know, just starting little things like that. It doesn't have to be a piece of legislation. It can be a small act in your community.
You and your analogies were spot on. I was like, oh, you need to write a book. And Michael and Tony K, you know, I would love to hear from you all as well. You know, how do you share our MPAF campaigns and resources in your community in a very unique way that works specifically for the people that you're serving?
I think in my case, honestly, more that I do is more at the legislative end of things, though, honestly. But when I talk to basically, especially in the community, though, yes, I am electronic more so. So actually with that, I actually do more of the electronic than the face-to-face, just because for me, y'all don't see obviously, but I use a power wheelchair full time. So for me to get out in the community and stuff like that is rather difficult. So for me, I get the words out a lot with MPAF through Twitter and Facebook and things like that, because I think honestly, I always like to joke about it though, but for congressional things, especially, Twitter is like crack. They love it, honestly. So because of that, though, if you mention a politician or something like that, though, you know, it goes out to all their followers and all their other things like that. So doing something, even if it's something that you're not leaving the house or anything like that, like you can still do a lot, though, honestly, with just social media, though, and get the word. I mean, that's kind of where we're at. We're all in this together. But the more people we can get basically in the boat, or basically, you know, to actually get, I think we can get a stronger voice. And I think that's the best way to approach this, though, honestly. So it doesn't necessarily mean going out in the community for me. It just means getting the voice out there, though, and getting the messages across.
You know, I'm going to kind of piggyback on what Mike just said. I'm not afraid to share my story. And I have overcome a lot of that feelings of shame of, boy, I couldn't cope as a parent, something's wrong with me. But no one could have coped, you know, in certain situations. And you do need help and support. So my local, state, and federal elected officials, they know my name, they know my story. I have some of the staffers that reach out to me and say, hey, can we use some of your story for, I don't know, some media that they're working on? And I'm very willing to share what I've been through. because I know that my story is probably the same as so many thousands of other people. And you have to speak out. You just have to bring everything to the surface, share what's going on, because if you don't know that there's a problem, how do you change things? And so I happen to have a very supportive church community, and I refer to my church as the elders there, they're movers and shakers, where they've been able to bring a lot of change to our community. And one of my qualities that people have identified is I'm a connector. So I have a social work background. I'm familiar with a lot of the programs that are underway in my local community. And I'm trying to connect different organizations that may have similar interests so that people are talking with each other and sharing information. And really care plans, as Mo mentioned, care plans have been one of my main focus issues that I'm trying to get the information out with our community because of what I went through my parents when they were at end of life. If I wouldn't have had their care plans to refer to on what their wishes were, there's no way I could have made the decisions that I knew that they wanted to have done, for how they wanted to end their life. And so care plans, high prescription cost, my mom's medication, when she started on this cancer treatment, it was $11,000 a month. And then when she stopped it, it was up to $13,000 a month. And we had to look for grants, and it's like high prescription costs are an issue. Get covered. I really appreciate knowing that PAF staff can help people in finding an insurance that's a good fit, because so many patients I talk to that have cancer, they have insurance that isn't going to help them, they're going to end up with some huge medical costs. But how do you know what you're going to need down the road? And that's where people that have experience can help walk you through what may be a better fit. So really care plans, high prescription costs, get covered, and then paid family leave. That's another issue that I've been working on in the state of Minnesota since 2015. And there's a lot more movement on the federal level now, which I am so happy. I hope more than ever that that's going to pass, because I went 1 year when I've been caregiver for 5 family members at the same time. 1 year I went without a third of my income, and that was a huge hit. But this paid caregiver leave act really would make a change, a huge positive change for so many people around the country if we can get that across the finish line. So issues that are close to my heart, maybe I've had that personal connection, but also what I see my patients struggling with are what motivate me throughout the day.
I love that you all touched on advanced care planning. We have our whole campaign, Be a Hero, Make a Plan. We have our financial resources directory that touches on all of the different issues that you all said that you're helping people in your community overcome and work through. And I know this whole session is about how you advocate, how you're there for others, how do you serve? But I think another important factor for our volunteers who are watching to really learn about is how to take care of yourself, because it's really difficult to care for others, especially when you aren't taking care of yourself, and Tony K, you just mentioned taking care of multiple family members at a time, but also realizing you have to be taken care of as well. So Maureen, I would love to transition to you, with your compelling story and always caring for others. How do you make time to care for yourself so you aren't overwhelmed with the level of servitude that you're providing for others?
Yeah, so like most things in my life, I had to learn this one the hard way. I was not taking care of myself. And like I mentioned before, my dad and my brother were both, my brother died pretty instantly, unexpectedly, but my father had cancer. So I was taking care of him. My daughter was diagnosed with epilepsy, and I was diagnosed then a couple weeks later with breast cancer. And I didn't ignore it, but I was not taking care of myself. and I wasn't really getting better. In fact, the last time we were all together, I had a pretty bleak outlook. But I realized that I won't be effective at anything if I'm not here. And so it took me getting really sick to wake up and make sure that I was making time for myself, making space for myself, paying attention when my body was trying to tell me things and not sweeping them under the rug. It's really difficult. I feel like most caregivers struggle with it. It's something that you have to do. And I feel uncomfortable with it sometimes because I feel like I should be doing something else. But if you don't do it, it will catch up with you. And again, yeah, I had to fall off the edge before I learned that, but it's incredibly important.
Like you said, it comes down to impacting how effective you are, and sometimes it's a hard wake up call for us to have, but it's necessary, and I'm so proud of you for being able to learn that lesson and now be more intentional about that. I think this pandemic in general has shown all of us the importance of truly taking care of ourselves, whether you're a caregiver or not. And so one last question that I would like to ask all of you is, what is the single most important thing that you would like to either accomplish personally through your advocacy work or you would like to see change in? And I know, Tony K, you mentioned earlier what that answer is for you, but Michael and Mo, I would love to hear your answers to that.
Mike, can I take this one first?
Of course.
Thank you. So what I would like to see is, I want a level playing field for everybody. That's it. I just want the playing field to be level for everyone. It should be fair. It should be accessible, healthcare in general. And right now it's not, for, many reasons, and of course that's a moonshot, but that's what I do, right? Let's level the playing field. But I think that kind of sums it up. Whether it's something big or something small, I just feel like we should all have equal access to whatever we need as human beings.
I'll go next, I guess. Honestly, by training, I'm a science geek, so mine's much more not necessarily as it's more ethereal, I guess the best way of saying it, though. So I want to basically have people be able to get the resources that they need and have straight answers on it. And so that's why, for example, right now, I'm really pushing hard to try to get telehealth legislation through here in Virginia, just because I want basically people to be able to access the best quality care that they can, the best quality doctors that they can, and not just basically be ascribed to a given doctor. The other thing that I'm pushing for right now is equality with regards to, again, I use a power chair full time and whatnot, though. And there's been, because of all the different things that have been happening in the Southeast with flooding and whatnot, though, there have been numerous people who basically, they were locked in their house and whatnot, though. So I'm trying to get legislation through also to help basically get them acknowledged and get basically people with a chair, people with a disability, a seat at the table, though, to help plan for disasters. Because right now that ain't happening. And so again, my answers are much more pragmatic, but I love like what y'all are saying, both Tony and Maureen, basically, though, just to address, the more pie in the sky stuff, though, which I really hope goes through, frankly. So thank you.
We need all of the ideas, pragmatic, heartfelt, all of them. Tony K, do you have any last words? I know you told us what your vision is, but anything you want to add before we transition to our breakout sessions?
I do want to echo what Mo had mentioned, where I talk with cancer patients from all around the world. And I know that some people have access to the experts, that maybe they can have some life-saving surgery, and other patients are never going to be able to leave their community because they are on medical assistance or, some type of insurance that they can't get through the door of a specialty center. So I as I mentioned, I would echo what Mo had said. Everybody needs equal access to quality, affordable health care. No one should be going without that.
Thank you. That is the perfect sentence to end on. Thank the three of you for joining me today. It has truly been an honor, and I know that Donna is smiling over us because this is exactly what she wanted: action, heart, and the service that you all are giving to your communities. So now I will pass it over to Melissa Williams to talk about our next steps.
Thank you so much, Ashley and Mike, K, Mo. That was a fantastic panel, and also just a wonderful kick off to this day when we're talking about advocacy, right? And I think the stories and the things that each of them shared is just such great grounding for the upcoming sessions we have. So Ashley is right. We have our breakout sessions coming up now. We have 2 for you to choose from. The first is Stories for Advocacy, and we will be featuring Martin Diego Garcia from the campaign workshop. And we also have another session called Evidence to Action: How Research Partnerships Can Advance the Science of Social Needs Navigation, where we will hear from Veena Shankaran from the Hutchinson Institute for Cancer Outcomes Research. So hopefully the link for the B session will appear in the chat. If you are staying for the story session, just hang tight. We will get started momentarily. Thank you all.
Hello, good afternoon or good morning, depending on where you're calling from today. Thank you for joining us for session 2A. I know if you're like us on staff, you're probably feeling motivated and inspired by the amazing remarks from our award recipient, Steward, and our other volunteers who joined for the last panel. So with that, I will just go over a couple of housekeeping items for today's next session, and then we'll turn it over to others on my team to go through some exciting advocacy training. So again, if you're just tuning in now, please, if you have any questions throughout the presentations, just enter them into the Q&A box. Closed captions are available for today's session. And if you have any technical difficulties or need help accessing something, please email us at npafevents@npaf.org. And again, please enter into the chat your name and where you're from or what organization you're coming from, because as you know, this is our volunteer community, and we'd love to meet and see where the rest of you are from. And again, we will be having our chat on social media. So if you'd like to join the conversation there, just use the hashtag #HealthNeedsNav to join that. And without further ado, I'll pass it off to my wonderful colleague, Melissa Williams.
Thank you, Nicole. Hello, everyone, and welcome. Thank you so much for your patience as we work through some of the technical issues to get this session going, but just wanted to take the time. You are not going to hear much from me today. You are going to hear from Martin Diego Garcia from the campaign workshop. NPAF has had the distinct pleasure of working with the campaign workshop over the past year, Martin and his team specifically, and they have helped us execute our campaigns. And we thought, what better way for our volunteers to see who has been helping support us by having Martin facilitate this session today and conduct this training on the importance of stories and advocacy. And I love that the last panel that featured our volunteers really helped set up, I think, this training. And so I hope you all will get as much information here to guide your advocacy. And so Martin, I'm going to turn it over to you now. Take it away.
Fantastic. Thank you so much. And I'm super excited to be here with all of you, and also have the distinct pleasure of working with the team over at National Patient Advocate Foundation on a number of the campaigns that I would imagine you all have had your hands in working on. And so thank you for all of your involvement in those. I get to do a lot of the behind the scenes creation of some of the toolkits and some of the information that you all get to see. But it is always exciting to talk to the folks who actually get to use them as well. So super excited to be here. Today we're going to be, folks over at NPAF have asked me to talk about storytelling and how a lot of movements, groups and organizations, advocates have been harnessing the power of storytelling in a very particular way in order to move folks to action. And so the approach that the team that I have been working with, we've been thinking through in terms of how they are engaging and activating you all as advocates and activists in the healthcare space is really to start building this groundswell of support from your friends, your family, your neighbors, your communities, to really have a larger voice when we come to legislators, policymakers, organizations who hold sort of the decision-making power there. And so what we're going to do today is walk through how you all should be thinking about utilizing your own personal story. I'm going to give you a pretty easy framework in which to structure that. And then we can and talk about how you all may be utilizing that, not only in the Health Needs Navigation campaign, but in campaigns to come. So if we can start the slideshow, please. Fantastic. So as I mentioned, today we're going to cover sort of why storytelling, why it's important, how folks are using it, and sort of just the thought process behind how we utilize storytelling. I'm going to then really specifically talk about how you all have probably maybe seen storytelling utilized before, and the difference between the sort of anatomy of storytelling I'm going to give you for this particular type of storytelling in advocacy. And then I'm going to talk a little bit about how you can utilize that storytelling in the advocacy work you're doing, whether that's recruiting other volunteers, whether that's lobbying policymakers. And then lastly, I'm going to give you some examples and a little bit of a storytelling workshop of actually one of your own folks among your volunteers here who has already done this for us in a video. And I'm going to be able to show that to you all to see how you all can actualize that with your actual work and your stories. So I'm going to talk about why stories. So give you a little bit of context in terms of why is it important that we actually utilize storytelling. So first and foremost, stories really ground us in our values, in the way that we tell stories, in who we highlight in stories, in the words that we use, in the types of stories that we tell. It really shows the type of values that we hold as individuals and NPAF holds as an organization. So most often, our stories likely involve our experience in the healthcare system, our experience as caregivers in interacting with that healthcare system and ensuring that people have access to it, right? Ensuring that it is equitable, ensuring that it is inclusive, ensuring that folks are able to navigate it in a way to get what they need as a person and as a patient. And so all of those things, and when you're telling come through in your storytelling and really show folks what you value as an individual. And so when you're thinking about storytelling, we often go to, particularly if we are super steeped in the content, right? We'll go to the policy talk and really like into wonk wonk land. We'll go into like the weeds of the healthcare system, which get like super complicated and have like really complicated words, right? And so once we start doing that, folks really start to glaze over because they're not relating to what you're trying to tell them. So the second reason that we really use storytelling is because we want to make sure we are emotionally connecting with the folks who we're talking to. I would really like to believe that we as humans make all of our decisions with our logical brains. That doesn't happen as often as we think it does. And we know that we individually, and we know that folks really connect to emotion and usually respond or react to emotion in a much more stronger way. And the information that we're telling folks that has an emotion behind it really resonates and is remembered more in the long term. And so when we think about storytelling, we want to remember the reason we're using it is to try to connect emotionally with our audience. The third reason is because we're actually wired for them. Stories have been used by communities for centuries to pass down history, to pass down information, to teach morality, to teach education. From when we are children. Before we're even in school, we're reading our children or reading our children books that all usually have some sort of lesson in them. And so people are already ingrained to understand, retain, and learn new information through storytelling. Whether it's books or movies, whether it's music, people really connect to the story and to the journey. And so that's where we want to really hone in when we're trying to share this information to get folks to communicate with us. Because the last reason, right, is facts are just facts. We can continue to throw out numbers and throw out facts to folks, but the more we throw those out, it starts to dehumanize the issues that are really important to us and the issues that we're working on, and makes it all about numbers and data rather than the actual stories and the impact that the system is having on actual people. And so just think about the COVID-19 pandemic. In the beginning, it was about stories of individual folks because there weren't that many cases. And once the numbers just started skyrocketing, it was all about infection rates and hospitalization numbers and death rates. And it was just numbers, numbers, numbers. And the numbers just kept growing. And at one point, even myself sort of just was like, I can't comprehend that because I can't see that number that big. And until they started coming back to start really individualizing it, and whether it was in the news or in regular conversation, people started talking about people they knew who had contracted COVID-19, and it brought that human aspect back to the conversation. And so remember that we want to make sure that we're putting a face to everything that we're doing, and facts can only do so much for them. They are still important as evidentiary support, right? We talk about the one case and then we say, this case is happening 100,000 times over in the country, right? And then it sort of gives that context to connect the dots for folks. So that's really why we hone in on storytelling and why they're so powerful to utilize. What I want you to be thinking about when you're communicating to folks and you're utilizing storytelling is think about the head, the heart, and our gut. Very often, like I mentioned, we often go to the head and we talk about facts and figures, we talk about evidence, we talk about policy, we talk about really stuff that's really in the weeds, and try to just give folks facts because we think when they hear the facts, they're going to automatically come to the conclusion that we need them to come to. If you have been living in the United States in the last 2 years, that's not the case, right? So facts aren't something that everybody sees in the same way. And oftentimes when we talk about a particular issue, whether it's healthcare, whether it's education, whether it's social justice, right? People in their brains and in their logical brain often already have a set opinion on that particular issue. Right? They'll automatically be like, oh, I've already heard this and I know where I stand on this particular thing. Whereas if you really focus on the gut and the heart, we're able to open up that conversation a little bit more and get a little bit deeper with the conversation. Because the gut is really that physical reaction we have to something when often we see unfairness or injustice or something we just in our body know isn't right, and or something we feel in our body because it's impacting us or our loved ones, right? So think about a parent who has their kid in school. I know my mother did this for me all the time. When I came home and just like nonchalantly mentioned something that happened at school that she didn't think was right, trust that my mother was in the principal's office talking to the principal about why I was experiencing these things in school. And it's because she had that gut reaction to what was at stake. And what was at stake was my future and my opportunity and my access to reach my full potential, right? And so when you think about the gut, you really want to lay out for folks what is at stake in this particular problem or this particular issue. If we don't embed health needs navigation into the healthcare system, people, I mean, at the worst case scenario, we will lose lives, right? Unnecessarily, because people don't have access to the resources that actually exist out there to help them get through what is their need, whether it's mental, financial, or social needs, right? These resources exist. And if we don't connect them to the right people, people might die, right? And so that is what's at stake. And so you want to really lay that out clearly so that people really feel that visceral reaction to be like, okay, I get it, I feel it, I want to do something about it. And you also want to ground it in the heart, because in the heart is where our values live. And that's the values around justice, around fairness, around accessibility, around family, right? What is the value behind the story that you're telling to connect with the people you're trying to talk to? Because when we start talking about values and at the sort of common ground level, we're not going here. We're not going to the brain and to the head where people already have a set stance on something. And we're going to the heart to say, well, don't you think that your loved ones, your neighbors, our community should have a responsive healthcare system so that we all have access to it? I can't imagine a lot of people are going to tell me no, right? Because we're talking about just access, right? Like people should have access to these things. And so when you ground it in a frame and when you frame it in a values framework, it's much easier to sort of open that door that may be closed if you go strictly to sort of policy or issue-based work. So the next thing you want to be thinking about is the goal, right? And the goal is going to change depending on who you're talking to. So if your goal is to recruit new volunteers, if your goal is to talk to healthcare providers or needs navigators in your community to get them on board with sharing the resources, if you're talking to a legislator or lobbying a legislator on policy, the goals are going to change, right? And so you want to be thinking about, okay, if I'm talking to my community to recruit new volunteers for NPAF, I may frame the story one way, versus if I'm talking to a legislator, I may frame it a different way. So to the volunteer, I may say, here's my story, and what I really need you to do is join me, because I know you have a similar story, in advocating for health needs navigation embedded in the healthcare system. Whereas if you're talking to a legislator, you may tell your story and say, constituent of yours, and I really need you to vote for this particular bill. The thing I'm trying to achieve by telling this story. So as I mentioned before, you all have been doing, sorry, did I freeze up there? Back. I was just saying in the last slide, just know the goal that you are trying to achieve, because it'll help you understand the story that you want to be telling, and it'll help you formulate what I'm going to get to in just a minute, which is going to be the ask that you're trying to get people to take. Now, ways to use your story. Some of you may be familiar in your volunteer experience with NPAF in doing some lobbying and some humanizing. And what I mean by that is you've gone to talk to legislators and you've used the hook, line, and sinker method, right? Where it's very specific and it's very succinct, because legislators don't have a lot of time, and you want to get to the point and you want to get to the reason why you're talking to them. And so it's a very rigid structure that allows you to get the information that you need to get across to the legislator, because they need to take a consequential vote. Fantastic, really great for lobbying. You also may have done the humanizing piece, which is the medical narrative, right? Where you actually just put a human face to the complications that exist within the healthcare system by sharing your personal experience of how you've interacted with the healthcare system. Also a great thing, also a super great tactic. What I'm going to be talking about today is the educating piece, which is a lot about what the Health Needs Navigation Campaign is and is going to be as it continues to grow, is just educating folks that this actually exists, right? And what is it, so that they know about it, so that then they become advocates, so that they're also humanizing and lobbying legislators, right? And so I'm going to talk a lot about how to use your story in the advocacy sense to move people to action. So as you think about your story, I want you to remember these three things. I want you to think about, what is the challenge that you faced, right? What is the problem, or what needs to be protected in your story? And you want to make sure that this challenge isn't super just individual to you, but is something that maybe is a collective challenge, whether it's a collective challenge among the type of community you live in, whether it's geographically based, whether it's the type of patient or care that you're receiving, right? What is a collective challenge that folks in your story can relate to, right? So I may not say something like, well, my specific situation, I was not able to access this healthcare because of my employer's insurance and because of the work job that I specifically work at. But like, that problem is very specific to me. Whereas if I were to say, not a lot of employers are providing a sufficient enough healthcare benefits, and I'm one of those folks, and this is my story, then I'm broadening that challenge to a lot more folks whose employers are not providing sufficient benefits. So you want to think about, what is the bigger collective challenge? Because you want to state that very simplistically at the beginning of the story, so that if I'm an audience member listening to you, I'm going to be like, oh yeah, that's me. The second piece I want you to think about is, what's the choice? And this is really important, because if you don't give folks a choice, they're not going to know that there's an action that needs to be taken. So this is the place where, again, where we talk to the gut. So if the challenge is, let's lay down the value, right? The value is everybody should have access to healthcare, and some employers are not giving that to their employees. Whereas the choice is really the gut. What is at stake if employers don't give those benefits to their employees? People don't have health care, right? Emergency rooms get filled up. Again, the loss of potential life unnecessarily because these employers are not providing sufficient health benefits. If we're, and the choice becomes, if we're able to take action and require the state to require employers to give their employees sufficient health benefits, then these people, we're not filling up emergency rooms, and people are not going into debt because of healthcare bills, and people are not missing out on rent, and people are able to put food on their table and feel secure that when they get ill, that they have a medical facility that they can go to, right? And if we don't, emergency rooms are going to be filled up. People are going to have so much debt. They're not going to be able to pay rent or put food on their table. And potentially we will lose some lives unnecessarily. So you want to give folks that really distinct choice so that then you go to the call to action and you offer them an opportunity to join you in action. And you want to say something along the lines of, and that's why you should volunteer with NPAF, because we're working on this really cool campaign right now to require employers to give employees more healthcare benefits. And we need to do it now because there's a bill up for a vote in the state legislature, right? So you want to give them, what is that opportunity that they can take action? Because you connected them in the challenge, you connected to their value. When you gave them the choice, you told them what was at stake, so they have that visceral reaction to want to take action. And then you gave them the opportunity to actually take that action. So as you're thinking about structuring your story, this is the structure I want it to be in. What's the challenge you faced? That's a collective challenge. What's the choice you're offering folks between, if we take action, here's the sunshine and roses, and if you don't take action, here's the doom and gloom, right? So that when you do provide them that opportunity to take action, they're right there with you, hoping to take action alongside you. So we had a video here that we're going to play, but I am understanding that the audio is not coming through. So Melissa is going to drop the link to this video into the chat. It looks like it was dropped. Thank you, Melissa. This is a video that Jimmy Kimmel did, and I would like folks to look at it later and think back to what we talked about and see if you can identify the value behind the story that he's telling and the challenge, the choice, and the opportunity that he lays out in this video. It's a really heartfelt story about his son and his son being born premature and having some medical conditions, and the challenge that he faced with the medical industry, and really relates it to votes happening in Congress and what action can be taken. Take a look at this. It's a really great example of how to tie these pieces together in a really simplistic way, particularly when there was a lot of medical terms that he was throwing out, but explaining in a really simple way. It's a good example of what I'm talking about in terms of the storytelling. The other thing you want to think about, and here's just some tips as you think through your storytelling development, is you want to be authentic. You want to be authentic to who you are and who the audience is you're communicating to. Because people these days, whether it's because of media or YouTube or social media, are a little distrusting of the news right now. And so the way in which we can communicate to folks and really cross that bridge of distrust is by being as authentic as possible. And sometimes that means being vulnerable. And being vulnerable takes some strength. And so I want you to think about, as you share your stories, some of them may cause some emotions to come up for yourself. And so you need to be prepared, practice, and processed through those emotions to be as authentic as possible. And to share those stories and what is important specifically to you, because again, the more emotionally connected we can be, the more powerful our stories are going to be, and the more they're going to resonate with the audiences we're talking to. And so I encourage you to, for as much as you can, be as vulnerable as possible with folks to really show them that, like, the healthcare system doesn't always help sometimes, and sometimes it's harmful, right? And what does that mean to you and your story and to the audience you're talking to? So for as much as possible, stay in that sometimes uncomfortable vulnerability space. Also figure out how to paint a picture, right? And as you look at that Jimmy Kimmel one, he shows a couple photos in it, and the photos say 1,000 words, right? And so what you need to do with your storytelling is help paint those pictures as well, so that you're taking folks on a journey and you're really taking them there, right? I think, so practicing what I preach here, I'm going to be a little vulnerable with you all right now and talk about my mother. She just thankfully won her third bout of cancer, a fight with cancer. She had breast cancer for a second time, but it is her third time with cancer and has just gone through some really, really tough treatment over this last year. And one of the amazing things that we were able to do was go get her fitted for a wig because she lost her hair. And so it was fun because we got to do this really fun moment. Me as her gay son who loves drag queens was able to sort of take her to a wig shop, and we walked in and there was all these wigs everywhere, and there was this lovely older woman who sat her down in front of the mirror, and we got to try on these like big fun wigs and these color wigs and these short ones and these long ones, and try all this different type of hairstyle that that she had never had before. And so we got to really have a good time and make light and fun in something that was really sort of hard and terrible. And if these and that wig place gave discount to folks going through chemo treatment, and so we now donate to that particular organization who is helping contribute to women who can't afford really expensive wigs when they're going through chemo treatment. And so it was just a really amazing moment in that really hard journey that we went through, that we were able to connect on as mother and son. And so when you're telling the story, you want to think about what are the things that I can do to sort of take you there, right? And so my mom sat at the mirror and we were able to try on these like really fun wigs, and they were all different colors and different shapes. And there was this older woman there, right? So you want to give a little bit of that description in your story so that people are then sitting there with you. And then give them a little bit of that emotion and paint the picture with that emotion so that people sort of see where you are. Because again, through the storytelling, we're going to take folks on a journey with us. And by using those sensory details, whether it's smell, sight, what did you hear when you were there, right? Like we were able to laugh a lot. So there was just a lot of laughter after a couple of months of some really sad times, right? Using words and sensory details like that really help paint a picture and give a lot of color to a story. So think about those details in your story as well. Here's the most important part, and I think the part in which is going to make this super powerful for your all's storytelling development. And it sounds like from what I heard from Melissa that the session before this, so you got to hear some of these transformative moments. Your transformative moment is going to be unique to you, but it's the moment in which you said to yourself, I'm not just going to sit back and let this happen to me or others. I'm going to actually step in and take action to change this so that for myself or my loved ones or for other folks encountering a similar situation, it's going to be a little bit easier, or it's going to be a little bit better, or this can't stand because it's just not fair. Right? What was that moment for you that allowed you to go from sitting on the sidelines to playing in the field and to taking that action? And it could be the first time, right? It could be the first moment you were like, I just felt lost and I didn't know what to do. And then I found a National Patient Advocate Foundation and decided to volunteer and see what I could do, right? Like, or it could be later on in your journey and be like, I was volunteering for a long time and then all of a sudden this thing happened, which made me really step into a leadership position. And then I was on every call and doing every campaign and like really honing, like really doing the work in my community. So think about what is that powerful moment that transformed you from being somebody who was impacted to somebody who was like taking action on it. Because when you focus on that moment in your story, you're allowed to show other people that it's possible to do, and it's not some huge mountain they have to climb, but it's signing up for an email list. It's posting on social media. It's talking to their friends and families, their neighbors, their community, folks they already engage with. And then little by little, we build up their leadership and their confidence. So then they're talking to their city council, and then they're talking to their state legislature, and then we have them lobbying in front of Congress, right? Like we build them up so that they start to take little by little actions and get much more involved. And that transformative moment helps them see that opportunity for them, right? And it can be placed in, again, that challenge, choice, and opportunity as you're recruiting for volunteers. And I think this is the part that sort of sets it apart from those other two types of storytelling that we talk about, where this talks this talks a little bit less about sort of your experience with the medical or with the healthcare industry, and a little bit more about individually, what was that thing that flipped the switch for you, right? Because it's much more about taking the action to fix the problem than it was about the problem itself that actually exists. So we have a video that I'm going to show you now from one of your volunteers, Nicole, who we trained up on this last week and was able to quickly put a video together. And so I want to share that to show you all how she was able to think about the challenge, the choice, and the opportunity to move into action while focusing on that transformative moment.
Hi, my name is Nicole
So
Davis.
we can go ahead and play
I
that.
am a board certified patient advocate and a resident of the state of Ohio. So one of the overarching challenges that I found myself navigating at one point or another in my journey so far as a patient advocate, and as a healthcare professional is the question of
Could you possibly restart that
affordability
so
of
it's from the
care and health
beginning?
insurance. So at multiple different points in that journey, I've been the patient that had amazing health care and didn't have to pay for immediate treatment. I've been the college student trying to manage a chronic health condition with no health insurance, and also as a patient advocate trying to help other people understand this complex world of insurance. So I realized that there were a lot of problems that were systemic and that could not necessarily be fixed in a doctor's office. So the way that I decided to go about improving upon those challenges and alleviating some of those disparities was by getting involved with healthcare legislation and health policy. So this is actually a field that I feel like a lot of patients don't necessarily utilize. In working with your legislators and partnering with organizations that have amazing policy agendas to improve health outcomes in your community, or to improve upon the criteria for aid and all of these other services that would make affording your care easier. I've been very blessed and very fortunate to be in a space where talking about your story and telling other people about your challenges and what worked and what didn't work is actually a thing. And as amazing as these platforms are, working with organizations like the National Patient Advocate Foundation as a volunteer allows you to have a different type of platform and be on a different type of soapbox, if you will, in front of the key decision makers in our country. So I would urge anyone who is interested in doing this, or just interested in letting their legislators know about their journey and things that they've learned to make the course of healthcare easier in the future, to definitely get involved with the National Patient Advocate Foundation, as you will totally learn a lot and you'll impact so many.
So, and that was only after about a 20-minute prep session. Nicole was able to put together that really amazing and powerful video where she talked about sort of her story, how she was impacted by the healthcare system, the different roles that she has played within it, and then give you that opportunity, that choice, right? She was like, I was able to make the choice to go into this field, which because a lot of folks don't know about it. And then from there, you were inspired to be like, okay, what can I do? And she went into the ask, which was become a volunteer with National Patient Advocate Foundation, so that you can also make your voice and your story heard, and you can be in front of those decision makers and those lawmakers who are crafting policy that can be sometimes harmful, but hopefully helpful and beneficial, and you can be part of that. So she really went through, here is my story and the collective challenge we face, whether you were a patient, whether you work inside the healthcare system, the choice in which people don't really know that these things exist. And if they did, they can really benefit from them. And if they don't, we're just going to keep sort of falling into these traps. And because of that, the choice you should make is volunteering with NPAF. So to recap, I am a super huge fan of utilizing, if you haven't can tell by now, of utilizing storytelling, but it will take some practice. So I want you to, for homework, think about what your story can be and how you can craft that to tell it to another person, your friends, your family, your community, to get them involved with the volunteerism that you all are already doing with NPAF. Thinking about what is the challenge you all share together, what is at stake in that choice they get to make, whether they act or don't act, and if hopefully you've convinced them and they want to act, what is that opportunity that you're going to give them to take some of that action? So I am done with slides now, so we can take some questions if you all have some.
All right, thank you, Martine. That was such an insightful presentation. We do have a few questions coming up. One here from Mary Stabile in New Jersey, who's asking, I hear that body language is important when speaking or telling your story. Do you have any tips on this topic?
Absolutely. Great question. Great question. I often, and if you are like myself and live in Zoom land for a lot of my professional experience now in the last year and a half, you've probably looked at yourself more than you wanted to, as I have. But what I will say, it has really given me the opportunity to see, like, when I'm listening, what does my face look like? When I'm talking, I've realized that I talk a lot with my hands and I gesture a lot. And so I would advocate that you practice some of this, right? Think about what your story is and then do it, whether it's in a mirror or on Zoom, right? And record yourself or look at yourself in the mirror as you're giving your story to see for yourself. Do I look engaging? Do I look compassionate? Is my body evoking the emotion that I am trying to portray in my story, right? Do you have a really inspiring story and like leaning in a little bit helps, right? Or do you have like a really like sorrowful story and your hands are sort of clasped in a way? Think about how does your body also convey the emotion that you're trying to get across without that adds to the story and doesn't distract from the story. I will say, if you're doing any of the lobbying, a lot of it is happening on Zoom now, or if you're having sort of Zoom meet and greets, or even if you're out in space with folks, if you sit on a chair that does this, don't do this when you're telling your story, right? Try to plant your feet, whether you're standing or sitting. Always try to plant your feet, because when you do this, people for some reason see it as like not confident. Or maybe you're not really telling the truth, because if you're telling the truth, you would sort of sit center, right? So think about how can you practice telling your story and sort of taking inventory of what the rest of your body is doing, because you do want to sit in a confident stance, but you do want to add some character to the story if you're able, that enhances the story. So absolutely, body language does matter. So practice on your little Zoom reflection or in the mirror to see, when I'm telling the story, what is my body saying?
Very helpful. All right, so we have another question about engaging the community. So it reads, in my community, one of the major barriers in getting people to share their story is the discomfort they feel around sharing something so personal. So how can I gently empower people to overcome this?
Great question. In the same way that you have, right? Vulnerability is a little uncomfortable for folks who don't do it very often. And sharing something really personal, right? When you can get emotional, for some people that's embarrassing. And so being able to provide this kind of structure that I laid out for you all right now may be one of those ways for folks, for you to say, let's write it out together, right? Like, what's the challenge that you're willing to talk about that you were able to face, and the story behind it, and a short story, right? We don't need the full in-depth, in the weeds, like half an hour feature length film story. We need the like couple of sentences that just give us a sense of what happened and how do other folks relate to that challenge. And then go into the choice, right? And the choice is a much more inspiring and like encouraging and empowering space to be in, to say, here's what's at stake. If we do act, we can really benefit a lot of folks. And if we don't act, it's really going to harm a lot of people. And then get into the action, right? Which is something that you all who are training your volunteers or your community to share their stories should be able to provide some examples of what they can use, so that you are then coaching them through what are you willing to share and practice with them that still feels comfortable and is still powerful and is still authentic and true to them, without really having to dive really deep into that emotional space that probably holds some trauma still, as you're thinking about having them prepare that advocacy telling story. And it also helps for you to know your own and repeat it back to them, so that they see an example of how it can look, that it is still powerful, it is still authentic, but it is still sort of within that boundary that they can set for themselves.
Right. And actually, to kind of build off of that, there's another question here about how can I share my story without coming off as trauma dumping? Ooh,
great question,
Yeah.
Particularly when we're in the healthcare space, right? It is often trauma we have for ourselves, or could trigger trauma that other folks have experienced, right? And so again, when you think about the structure, we don't have to go super in depth into the trauma piece that happened, because what you're trying to lay out is a framework for, this is this thing that happened to me, and I know it's happening to a lot of other folks. And what was the sort of impact on you that does, and be frank about it and be like, and there is some trauma that I'm dealing with in regards to this scenario. But what I want to talk about is, and sort of move, and what you want to do is just not leave people in that trauma space, right? You want to move them into the choice space, because the choice space is that like inspiration, empowering space, right? It's that space, it's that journey that allows you, and that's that transformative moment again, right? It's that journey that allows you to say, this thing happened to me. And yes, it had some trauma around it, but what I was able to do was transform that into power. And by power, I was able to take action, and here's the action I'm hoping you take with me. So the hope is that you're sort of still taking them on a journey to say, there is a way out of that trauma, and the way out of that trauma is this choice you have to make, which is hopefully take action with us. Because absolutely, you want to know that that is traumatizing for you, and for some folks to share that, and be able to process that, and however that looks for you. But the hope is that you're taking people on a journey from trauma to inspiration to action.
Right. And I think especially with storytelling, when, you might be in a situation where you're in front of a legislator or, some hospital system official, it might feel, nerve-wracking. So really the preparation from this training, I think, is definitely keys to, moving from the trauma piece to then the power and the action. So I'm sure everyone is taking good notes from today's session.
Yeah, and sorry, Nicole, I wanted to just add as well, this is Melissa, that acknowledging that emotion, I know Martine, you talked about it, I think is also incredibly important here, right? No matter if you're talking with someone in your community that you're trying to engage, or a policymaker, it's okay to acknowledge the emotion that you're feeling, because I think, again, it goes back to that slide that you showed, Martine, about, getting at the heart and the gut, because people respond to that. And I think, I'm thinking back to the times where we've had to coach some of our volunteers when they are sharing their stories, and our volunteers have gone through some really tough things. And I think our panel before, showcased some of that, but you're right. They transformed that, or they talked about that transformative moment and really channeled it to the action that they're doing now. And I think we have time for one more question.
Sure. Yeah. So, okay, this is about tailoring stories. So the question asks, what are some tips I can use to identify how to tailor my story to different audiences? For example, not everyone can relate to a traumatic or negative experience. So how can I hook a legislative audience?
That's a great question. And I think it's going to take a little bit of practice and a little bit of time, because I think as you continue to engage in this space, you're going to have to test some of that, right? And you're going to have to test, how do I take this story and make it not necessarily universally relatable, but at least relatable in that values framework, right? And particularly, hopefully, for legislators, values are strong for them, right? And so when you're again able to connect it to something you know they value, opportunity, access, our future as a country, right? Their constituents. What is the value that you can connect that story to, that the story becomes then evidentiary support to that value, right? And so it's going to take a little bit of research to see, how does a legislator work? What are the things that are important to them? And then how do I utilize my story to connect with those pieces of importance? Is it financial? Is it business related? Is it security for their community, right? What is the thing that is important to them? And then how do you connect your story to that value? Even though they may not relate directly to your story, you can frame it in a value of safety or prosperity, right? Or access that you know is important to them, that then again connects you all in the heart, so that then they feel it in the gut.
Great. Well, thank you so much, Martine. It was such a pleasure having you join us from the West Coast. And really also appreciate you kind of leading by example here in, the story that you shared and being vulnerable. It definitely requires a lot of strength, but we're all your family here too. So I'm glad we can have this conversation. And with that, thank you to everyone for engaging in this training. We will be taking a short break and should be starting our next session number 3 at 2 p.m. Eastern, titled How Effective Organizing Can Lead to Policy and Practice Change. So stay tuned and we'll see you shortly back on the main stage. Thank you.
Hi, everyone, and welcome back to our final session at Patient Congress 2021, Health Needs Navigation. My name is Melissa Williams, and I'm the Associate Director for Policy and Field Advocacy, and I have pleasure of introducing the presenters for our next session, which is focused on community organizing and how that can lead to policy and practice change. Before I turn it over to them, we're just going to go over our housekeeping items just one last time. Please submit any questions you have into the Q&A box on the control panel. We have closed captions available in this session. And if you are experiencing any technical difficulties, please email npaf-events@npaf.org. And lastly, please join our conversation on social media with the hashtag #HealthNeedsNav. So it's my pleasure to turn it over now to my teammate, Mary McKira, who will go over the importance of community organizing. So Mary, take it away.
Thank you so much, Melissa, for that introduction. So as my colleagues have highlighted here today throughout Patient Congress, and especially today, is that the most powerful tool within grassroots organizing is the power of storytelling, especially when you can relate it back to your audience. And we want to make sure that we emphasize that we have a truly unique opportunity here to bring grassroots advocacy into the healthcare space, especially as it relates to the unique experiences with patients and caregivers. And how we're best able to do this is through effective grassroots organizing. And just to sort of go back with my background in organizing, what drew me to NPAF was their high focus on centering and amplifying the patient and caregiver experience. Within my experience in mainly political organizing and policy, this is something that you hear a lot, but it's not something that you actually see put into practice. And with NPAF, a lot of this centering and amplifying, it's not limited to campaigns. It really is embedded within the fabric of the organization, whether it's resources, hiring, partnerships. This is something that was so refreshing to me, to join an organization that really does have a high standard to uphold its mission through and through with everything that we do as an organization. So with that, I want to go into some of the major things we're going to be discussing today. So our key objectives here are going to be discussing our approach to advocacy, what grassroots organizing is, what effective organizing looks like, and how you are best able to utilize your unique story in our Health Needs Navigation campaign, which is kicking off this month. And you'll hear a little bit more about that later on in the presentation. So to start, our approach to advocacy is twofold. It's us having a person-centered approach and us being community-driven. And to sort of level set what this person-centered approach looks like, it's really about making sure that you are having intentional and specific conversations, tying in that personal element through the conversations that you have with people and building a personal connection to the initiative. When you're having a conversation with someone, it's important that you're not repeating talking points, because that gets boring. There's no personal connection to that, and people, they're going to forget it. They've forgotten as soon as you said it. You really are connecting the dots between how this issue impacts their community and ultimately them directly. And of course, us being community driven, while we are a national organization, one sentiment that we echo often is that you are the experts in your community. Nobody can talk to your community like you can talk to your community. You understand the nuances that exist there. And this grassroots approach is far more effective than having somebody from another state, another country, tell you what you need to do in your community, because that's incredibly frustrating, because they don't know you or your experiences or your community. And that's the best way that you're able to have a more direct impact and able to institute change. And looking at what grassroots organizing is, there are three major pillars that exist within grassroots organizing. We have the capacity building element, we have communication, and there's also accountability. So within capacity building, what that looks like is, as you guessed it, general recruitment, and of course, relationship building within that. So with relationship building, it's important that you're not recruiting for the sake of having numbers and to tell people, oh, well, I had 10,000 signups, or I had 50 signups in a town of 70. That sounds great, but if there's no backup or follow through with those numbers, it's ineffective and it doesn't really matter. You have to build these relationships. Having a direct conversation with someone can really motivate them to take action where they otherwise wouldn't, because you made that relational connection. And of course, if you really look at this from a tactical perspective, and if you talk to your mom or your sibling or a good friend of yours, you already have that foundational relationship, and bringing them in to this specific issue can really take it a step further, because they already have that built-in passion to support you and what your goals are within this initiative. And with communication, it has to be intentional and consistent. So with intentionality, sharing a personal story and why a certain thing matters to you really does draw your audience in. And if it's delivered well, it anchors them. Your communication should also be very consistent. You want to make sure that people are kept informed about the progress you're making. You want to make sure that you are sharing how their specific advocacy really helped move forward an issue and the latest actions they're able to take to continue on with that. If you think about it, to bring it back to our organizing days within politics, how strange would it be if we elect people into office and they don't tell us what they're doing? We want to make sure that our vote counts. We want to make sure that our time investment counts, and that we understand what's going on when we've committed to something. And of course, with accountability, our goals and metrics, we want to make sure that the goals are achievable. There's a lot of things that you put forward in the foreground for people to do, just quick actions they can take here and there every week. And there's also a lot more goal setting and metric tracking behind the scenes. But you want to make sure that when you're initially communicating these issues to your community, that these are achievable goals and it makes sense for your audience. Because maybe writing to your senator doesn't make sense in your community because maybe they don't like the senator and they don't want to do it. Or they're like, oh, it's going to fall on ears that don't really care about this. You want to make sure that you're communicating in a way that makes sense. Maybe hosting a rally is a better way to get the attention of somebody, as opposed to writing a letter that may fall to the wayside. You also want to make sure that, again, going back to that communication piece with accountability and goal tracking and metrics, that you are sharing the successes. You want to share where you're falling short as well, and encourage your community to help you better achieve your goals. And next, we're going to talk about what effective organizing looks like. So I think every organizer and their mother has heard these three terms used over and over and over again. Effective organizing, it really is fairly simple. It's not too complex. I know with campaigns a lot of our volunteers have participated in this past year, we've got a bit more granular in exactly how we're able to organize. But high level, what it really takes is organizing, mobilizing, and engaging your audience. So when we talk about organizing, it's about starting early, building capacity, and being persuasive. With that persuasive piece, it's the best way that you're able to do it is, again, don't have generic talking points, really connect it, be disarming with sharing your story, sharing something that you know that the individual in front of you can connect to. And of course, with organizing, it's about starting early. So this health needs navigation campaign, for example, didn't happen overnight. This is not something that was, put together over the last 2 months. It started off as a conversation. Then there was extensive research that is still being surveyed and done. And this is something that will certainly take years to continue to build on, because the healthcare landscape is ever changing. So you want to make sure that when you're organizing, you're starting early, you build capacity, and you are persuasive. With the mobilizing element here, you want to make sure that above everything, you really want to make sure that fellow advocates are educated on the issue, there are resources available for them to refer back to, and there is some level of training as well available to make sure that they're comfortable with the action that they're taking. In our previous session, hosted by Maureen, who's co-hosting this session with me here today, one really key thing that he spoke about here was, when you're sharing your story, you kind of want to run through it a little bit. You're identifying the challenge that exists within your story. You share the choice that you made. This was my challenge. I made the decision, a choice that I didn't like this challenge, and I don't want anyone else to face it. And then you go to that opportunity for action. So therefore, I'm going to take action. It's not enough for me to be upset about something. It's not enough for me to wish that something could change. You have to put action behind these emotions in order for there to be effective change. And of course, engaging your community, you have to know where your community stands on an issue. And you have to tailor the message to make sense to the person in front of you. One example I can provide is when I would be door knocking, getting people to care about a particular issue. If I'm knocking on a door and in front of me are a bunch of toys, they're small bikes, little swings, I'm going to assume maybe education is the most important thing for this person that I do not know. So I'm going to go there with the intention of opening up with who I am, why I personally care about education, and talking about how it can relate to them. So just really picking up little pieces here and there that takes time. And of course, with an engaging, outlining specific actions. So I'm going to go ahead and pass the baton to my colleague here, Maureen Garcia from the Campaign Workshop, who is going to share some effective lobby to storytelling strategies with case studies that really hone in on that person-centered element. And Maureen has extensive experience and political and initiative-based organizing, and for many years now has also led training and development for organizers, which is exciting for us to hear from, and political candidates as well. So we are in phenomenal hands, and we couldn't have asked for a better person to help lead this discussion.
Thank you so much, Mary. I am super excited to be here. I was just able to do a lovely breakout session with some of you all, and now I am back here to talk about something that, if you weren't in the first session, you know now that I really, really, really love storytelling and the power that storytelling has to connect across issues, across partisanship, across any type of difference. It is really such an amazing tool that organizers have used for a very long time. And now we're seeing everybody really use the idea of a personal story and how to connect that to a larger community, a larger challenge, a larger movement in the space. And so what I want to do is give you all a couple of examples. So as you all are doing the work and the volunteerism with National Patient Advocate Foundation, whether it's through the Be a Hero campaign, Caregivers Count, Needs Navigation, or Get Covered, there are always opportunities for you to engage other volunteers, recruit new folks, talk to your community, engage legislators through storytelling. And so I want to show you sort of how some other campaigns have really connected the dots for their advocates and their supporters through the power of storytelling, and that pivotal moment when they were like, oh, right, we just need to add a human face to these issues, and the sort of landslide responses that had come subsequently. Go ahead and click the next slide. So the first case study that I'm going to talk about was the case around marriage equality. And most of you probably, in one way or another, whether it was through the news or through engagement with folks in the LGBTQ space, have probably heard about this amazing campaign that happened over the span of about a decade. Back in in the early 90s, there was the initial sort of campaigns around LGBTQ rights and LGBTQ discrimination. And there were a couple key wins that happened in the judicial space that allowed for the campaign for freedom to marry to happen. And in the early 90s, around 1996, there was a court case that happened in Hawaii. And it was a court case where the circuit court in Hawaii deemed, or the state Supreme Court in Hawaii deemed it to be unconstitutional to discriminate on the basis of gender when it came to the institution of marriage. So that having same-sex marriage left out of was unconstitutional to be discriminated against in the institution of marriage. Well, when that happened, it set on a plethora of other dominoes. And after that, and over the course of about another decade, there were a number of different strategies that took place. Go ahead and click to the next slide. In the pursuit of the ability to change policy and to have the freedom to marry to become the law of the land, there were a lot of different tactics and strategies that were used. There were a number of different legal battles that happened all across the country, from the Hawaii case to cases in the Northeast. When a couple of the first state marriage campaigns were happening, they thought, well, if we can just get it through the court system, that's the fairest system we have. And if we left it up to the court of public opinion or to voters or to legislators, it likely would never happen because we don't have those hearts and minds on our side of the campaign. What they often saw then were failed legislative initiatives, some failed court appeals, and when they did have successful court judgments, they then saw citizen initiative ballots go on the up for election to revoke what the courts then said. So in Hawaii, what ended up happening was that they put a ballot measure on up for election, up for a vote of Hawaiians, to vote to say that the legislature was able to amend the Constitution to say that marriage should only be between opposite sex couples. And so there was this back and forth between winning in the legal space and losing in the court of public opinion. And so what happened in probably around 2010, 2008, 2010, there were a number of state campaigns that then we were running in the marriage fight to put pressure on legislators to show that there was support in the court of public opinion and that the public was on the side of marriage equality. However, what happened there in the messaging was where the sort of lesson here comes from. All of the campaigns leading up to about 2008, 2009 were all about the right to marry. It was all about these rights that the Constitution, whether it was through taxes or abilities that allowed married couples to be in charge of estates and medical decisions and all of these other pieces that came along with the institution of marriage, all of these other benefits. That's what the message was about, that we as same-sex loving couples should be allowed to have those rights and those benefits. Well, what they came to find out after losing a couple of campaigns is that message didn't work with the average person, or a person who either wasn't involved in the LGBTQ community or knew anybody involved in the LGBTQ community, because the way that they saw marriage was of love between them and their partner, or the husband and the wife. And so after a lot of testing and a lot of polling, they realized, oh, we can't just talk about the like wonky policy stuff. We actually have to put a face and some emotion into the campaign and the language that we're saying. And as soon as they swapped the messaging to the ability for us to love our partners and express that love to our families and our friends in a public way, and a commitment that is the institution of marriage, then all of the other folks sort of started to click for them. Like, oh yeah, they should totally have the right to express those vows and publicly disclose that they want to love this person for the rest of their lives, right? And so it was that idea of turning that messaging on its head and really focusing on that human experience of emotion and connectivity and values, that a person should have the ability to love their partner and engage in the institution of marriage because they love each other and they want to spend the rest of their lives together. That was a values-based framework that connected on emotion, and then that's when we started winning a number of different campaigns. And then through the judicial system, once it did get to the United States Supreme Court after long, hard fought battles and conversations to change those hearts and minds, it was through those powerful personal stories, whether on the ground in communities, to win those statewide campaigns, that it showed the United States Supreme Court that both legally and in the court of public opinion, the support was there to make marriage equality the law on the land. And so as you all think about bringing your folks along, it's utilizing those personal stories, as Mary mentioned, in a really connective and constructive way to change their hearts and minds and hopefully move them to take action. In this case, it was getting those folks to vote in benefit of freedom to marry whenever that ballot measure came up on the ballot. Next slide. So another case study that I want to talk about is one that I Am ALS and the ALS community has been doing for the last couple of years, back over the last decade or so, but really sort of honing in on the piece that I'm talking about with I Am ALS that was founded about four or 5 years ago now, in their campaign to hold the FDA accountable for accelerating the search for treatment. ALS is a very, very harsh, terrible disease that they're doing a lot of work and research on. And over the last couple of years, there have been incremental successes in treatments that they have been testing and the pharmaceutical companies have been coming up with and doing some clinical trials on. This particular instance, in this particular case, there was a treatment that in early case trial studies had shown some really positive results, but folks who have been diagnosed with ALS didn't have access to it because the FDA requires 3 trial tests and a particular amount of positive results to then allow it to get to public distribution. Well, what the FDA, what I Am ALS and the ALS community found was that through doing research funding and understanding what was happening in the treatment space, not only in their treatment space, but what was happening in other treatment spaces, they had found that the FDA had approved expanded access for another treatment that had very similar results to the treatment that to the drug test that was for ALS for Alzheimer's, and that the FDA did approve the early expanded access so that folks with Alzheimer's could get that treatment earlier than it would be than the FDA would approve for early access. Well, ALS was just asking for the same thing, and they kept getting shut down by the FDA because they weren't meeting these other requirements. And so what they did was they really honed in on, over the last couple of years, building out the community, educating folks on what ALS is, educating folks that they probably know somebody who is suffering from ALS, and the statistics around somebody who is diagnosed with ALS only lives about 3 to 6 years after diagnosis. And so they started collecting all kinds of stories. And with those stories, they were able to highlight much more attention. They were able to use those stories to talk to legislators. And ultimately, the founder of I Am ALS and his partner were able to, along with many other folks, researchers, doctors, and treatment folks, tell their story and advocate in front of Congress and get them to approve the early expanded access for that particular drug and get the FDA to approve that. And so again, they were trying to go through the bureaucratic system, right? They were trying to do what people are telling them to do. And it wasn't until they had put that human face again and started building those grassroots relationships all across the country to get folks from coast to coast to be calling their Congress folks, to be calling their legislators, and really putting a face to the issues and the stats and the facts behind how ALS impacts patients, that they were able to get that groundswell of support, get that momentum going that they were able to testify in front of Congress, and that they were able to actually move policy that will hopefully benefit some of these folks who are suffering from ALS. So again, it was honing in on how do we see what is the process to change policy, and how do we add humanizing on top of it, right? Like, how do we add the storytelling component? It's not to say that only storytellings are going to win you the campaign or move the needle there, but what it does say is by layering in that human face, that human story, that emotionally connective component to an advocacy campaign or a legislative campaign, it pulls at those legislators' heartstrings, right? It really gets them invested and connected to the issue that you're talking about, that allows you to move the needle as is needed to be. And understanding that, like, both of these campaigns took a really long time, right? The marriage campaign started in '96, right? And then became the law of the land in 2018, I believe, right? So spanning over a lot of years, decades even, with ALS folks been fighting for treatment and access to treatment for a really long time. And this particular campaign did take about 2 or 3 years to get them to get that early expanded access. And so thinking about the things that you all are doing now for needs navigation, which is a new campaign for you all, is this initial part of building that groundswell, of sharing your story to recruit more folks, so that when we do get to the place where there is policy and advocacy for you all to advocate on behalf of, it's not just you, right? It's you and your entire community who's calling your decision makers and your legislators, and they've already practiced how to tell their stories, so they're able to connect that and bring that emotional connective piece to their advocacy to layer into that policy ask and make it so much more powerful when we get to that point. So it's really sort of taking folks through this journey. The last thing I want to talk about is the user-generated content. And what user-generated content really is just content that we produce as people. Right? In the last couple of years, a lot of folks have started to just distrust traditional media, right? And we are seeing, both in the advocacy and the political space, but also in the general just marketing and consumer space, people are starting to utilize personal stories to build trust with their consumers and their constituents, because we trust each other. We just don't trust corporations, and we don't trust the media, right? And so by, again, humanizing what the product is, humanizing what the issue is, we are a source of trust as a messenger. And so we are going to be seeing a lot of, whether it's through the Bose video, if you've engaged with that before, whether it's through writing out your story, writing a poem, telling your story in some way, provides you as that really powerful messenger and a trustworthy one. It also allows people to envision their own lives, right? It allows them to see that transformative moment that turned you from somebody who was impacted by the healthcare system to somebody who is taking action to make the healthcare system better for themselves and others. And when you're able to show that journey for somebody, they're able to see themselves reflected in that journey, and hopefully then be empowered to also take action, right? And empowers everyone to be an influencer in their community, in their circles, in order for folks to take action. So when you see this word, user-generated content, it really means that we're just asking you to share your story in a way that we can then utilize it in other campaigns to build that trust, to allow folks to envision themselves doing those actions, and to make you an influencer within your community.
Thank you so much, Martine. That is powerful. The reality is, as Martine just mentioned, is that when we're able to hear from people on the ground, people with that specific, unique experience, that is the whole truth. There are so many experiences that have not been heard, and they don't want you to hear that because people don't like, fingers being pointed at them. But it's not necessarily about finger pointing. It's about acknowledging that there are gaps that exist because humans are fallible. Therefore, we make fallible systems. And every generation will continue to get better when we call it out, call the issue out, and call people in to make it better. And the only way to do that is to be honest about the issues that exist. So, Martine referenced this previously and again in the session earlier. And he's said something really important, and I may butcher it a little bit, so please chime in if I do. But, he said, make sure that you're connecting your story to what that person or organization may value. There's so much power and so much strength in that. The same way that you wouldn't, for example, if you're telling a funny story that happened to you, you may say it to your friend differently than how you would tell your parents. You may, because you want to say certain things, change the lingo a little bit to make more sense to the audience that you're communicating that with. Same with legislators. There's a specific language, it's a specific way that people talk and that people walk and they communicate, and you want to make sure that you're sort of adjusting to that. And thank you so much for echoing a lot of those same sentiments here. And we want everyone to take action. So donating your story to our health needs navigation campaign is essential. Our primary goal here for this campaign is to embed financial and social needs navigation services within our healthcare systems. And while that seems like a high order, there's so much that you can do on the community level. And using these 3 words again, how you're able to organize this, how you're able to mobilize, and how you're able to best engage your community. So begin with who you know. For example, if you are a caregiver and you know that you could have benefited from financial and social needs navigation services, how invaluable that could be to you as a caregiver and to the person that you are caring for. Understanding with this mobilization part that your story is an effective resource. As Martine spoke in the previous session, and we referenced earlier here, identifying what the challenge is, the choice you're making as a caregiver to make it better, not only for yourself, but for caregivers at large, whether that's in your community, in your country, however that may look like, and the choices that you are going to be making, not only on an individual level, but as a community. What decision are you going to make? What type of a community do you not only want to live in, but what community do you want people after you to exist in? And with engagement, understanding how your specific community needs can tie into these campaign actions. So, if there's a specific campaign action that says, write an op-ed or write a letter to the editor, whichever way makes sense for your community. Sometimes it's people don't read the paper there, and maybe you just post something in a local bakery, because everyone goes to this bakery, everyone knows this shop, and at least 20 people a day are going to see this. That is your building noise around this naturally. You may not see it, but it's there. And that's a strong way to really understand, okay, what does my neighborhood typically do? What do I typically do within a day? What places do I go into? And make sure that you're engaging and reaching people where they are. So to go into the campaign calendar here, we have our health needs navigation campaign that kicked off on September 30th. And next week, we have our week of action. So after the close of today, this evening, you're going to be receiving a follow-up email. And of course, we will share with you the campaign webpage that you're able to learn more about how you can participate. And there's also a campaign toolkit where you can get started on how to really get this going in your specific community as well. And we have different actions that you could take. And we have our campaign digest that we send out weekly with additional actions. And one thing we want to make sure that we highlight here is that if you want something to change, if you want to be influential, it starts with one person. It always has, and it always will. And there's no small action, and there's no small way that you can have an impact. I will say some of the most compelling stories that come out of grassroots organizing are the ones where you just see one person on the street with a sign by themselves. People are more drawn to those stories than, I mean, of course they are to larger stories as well, but that makes its rounds more, and people are more interested by that one person living in a community where that seems so far-fetched. And if you reach one person, that is awareness built, and that is support solidified. So don't take for granted the one person that you may reach. That is significant and that is impactful. And one of my heroes in life, one of my biggest inspirations is the late Congressman John Lewis. And his words and his legacy, frankly, are one of the main reasons why I even stay in advocacy. It's an incredibly fruitful thing to be a part of, but it's also very exhausting. And I don't think anyone can say it better than individuals like himself and individuals who had organizations like NPAF. And I want to leave you with his words that speak directly to what we're trying to accomplish with this campaign. Sometimes you have to not just dream about what could be. You get out and you push and you pull and you preach. And when I look at this quote and I look back on a lot of his legacy, I think of our volunteers. I think about Maureen Steward. I think about Tony K Manskowa. I think about Michael X. I think about Mary Stabile. I think about Jamie Stokely. I think about everyone. And wow, what a tough life of advocacy that you are committed to, but the impact is immeasurable. These are real lives that you're changing. And just want to make sure that I leave you all with that. So I will go ahead and pass this to Melissa for the Q&A.
Thank you both for sharing just such a beautiful presentation. And just, I think you guys really got to the heart of what we are trying to do here at NPAF and in Volunteer Network. Our goal here is to bring a movement, right, to the healthcare space. We want to really make sure that your voices are the reasons why we get needs navigation embedded into our healthcare system. So I think I'll put a plug in for questions, to please enter them into the chat. I do have one teed up here for both Mary and Martine. It was something that had come up in our kickoff call last week for our Health Needs Navigation campaign. And one of our volunteers had asked, with these campaigns and when it comes to organizing, like, how do you not rock the boat when in terms of like getting, partisan or political? And I'm wondering, Martine and Mary, if you can speak a little to, about just, avoiding the politics.
Happy to. I think what you need to think about, and particularly I think this is where storytelling comes in handy, is that you're sharing a personal story to you that connects to the community, right? And specifically right now for health needs navigation, there is no policy yet written in which you are advocating on either side of, right? And so you're able to still build the groundswell and build the message and controlling the narrative to say that this is an issue that impacts across race, across gender, across socioeconomic status, across partisanship, right? You right now have the power to decide that this is something that everybody should be involved in and that impacts everybody, because at some point or another, everybody is going to engage with the healthcare system in one way or another. And by starting the narrative in that space and utilizing your stories to show the variety of different ways that this is impacting individuals across the spectrum, right? allows you to hopefully start it out of the very divisive political space we are in now and keep it there. And again, when you sort of go back to that values framework, when you go back to what's at stake, that hopefully also pulls it out of that like in the brain issue-based, fact-based, right, divisive politics-based land and brings it back into like reality and like human day-to-day lives. And so keep doing that and keep remembering that sharing your story is not political, right? Is connecting on a human level that hopefully gets us back to a place, or at least moves us to a place where we're seeing each other as humans and not just D's or R's.
Definitely. I completely agree with everything Martine said. And ultimately, I think it's important that we recognize two things. Nearly everything in this life is political, and not everyone is going to get on board, regardless of how positive your initiative may be. And, you know, a lot of topics are incredibly sensitive to talk about, either because there's trauma associated with it, or because people are simply going to disagree for the sake of disagreeing. And I think with this in particular, with health needs navigation in particular, how to depoliticize it is, as Martine had mentioned, bring it back to the high level goal. Some people, for one example that I like to give is, if you retain an attorney, you are not expected as the attorney's client to know everything that your attorney knows. How unfair would that be? How unfair is it for you to get someone who is a professional, who went to school for this, who has practiced for however many years, who knows where to go to look for information, and have that attorney expect you to be on their level? That is not going to happen. We all have our skill sets. Well, as smart as we all may be, it is just not possible unless we get that, unless we do what they did. And we applying that to the healthcare system, being a provider, being a health navigator, whatever that may look like, being a patient or a caregiver, you either have that unique lived experience or that specific learned experience. And communicating sort of those differences that exist, saying, you know what, I just don't really know where to go for help, or I had this happen to me or someone in my community, and I want to make sure that it doesn't happen to anyone else, or people know where to go. Have that point of contact, have this be normal and embedded into these systems, and really deconstruct this idea that everything has to have a political attachment to it. And you're not going to get everyone, but I think just acknowledging that within yourself and bringing examples that can directly speak to the people that you're communicating with is strong. Because when you're able to just really make it, you know, super simple as far as, okay, well, I'm not an attorney, I know I'm going to need one, you know, for whatever situation. I think that certainly helps ease the conversation, and not to be combative as well. And honestly, one thing that always works is just, as cliche as it may sound, is just being kind and really bringing yourself and your personal experiences to it as it fits. You don't have to, you know, dump your entire story there, but just high level talking points that make sense. And that typically will capture people's attention there.
Thank you for sharing that. I'm reminded of a couple things as you guys have been talking, but I follow a lot of #Ned Twitter, and I think a lot of other patient advocates do as well. And there is one doctor, her Twitter handle is @GradyDoctor, who I've been noticing over the past year. She practices out of Atlanta. She's a Black physician, and she has made it her personal, I guess, just form of advocacy to educate people in her community, Blacks who are inherently distrustful of the healthcare system, to educate them about the COVID-19 vaccine, or the vaccine, and talk about why it's important to get vaccinated, or hear exactly why. She uses the hashtag Black Lives Matter. And I've been following her threads for, yeah, as I said, over this past year. And she posts these really meaningful conversations that she has, and they're like short stories, like a dialogue that she has. And there was something that I saw that she had retweeted last week where someone who she doesn't know saw her image and was just like, this doctor is responsible for me getting the vaccine. And I think that is just an example of storytelling, connecting with people at an individual level, having conversations, and and using that to educate them and help them make that choice, that informed decision. And as you all were talking, I was just thinking about that. I urge everyone to follow her, to give her a follow. She's great. And I just think that that is just something we really want to emulate here with our health needs navigation campaign. We can have those same conversations with people when we're waiting in line at the grocery store, or we're waiting in the waiting room, where we know people are already interacting with the healthcare system. I know some of our volunteers have already shared that that's what they do. And more of you having those conversations, and more people, saying like, you know what, yeah, that's the experience I had too, and that shouldn't happen to me. That's enough to build that, I guess, that domino effect to eventually organize and get the attention of the policymakers that we need to influence to make sure that we embed needs navigation as part of healthcare. So I think we are at time. I wanted to just thank Martine and Mary for a wonderful final session. I've been seeing some comments come into the chat, just saying what a great way to close Patient Congress. Love the visuals. So just wanted to share that with you all, because I know you can't see, but thank you all. And at this time, we are going to turn it over to Rebecca Angove and Rebecca Kirch, who will have final remarks here as we close out Patient Congress. So I want to make sure that they are ready. And as they're getting ready, I will just tee up that we would love for you, as we've mentioned on our previous days, to share your feedback with us. We will be including a survey in our email that goes out later, but you will also see it pop up once you close out the webinar today. Please let us know how we did. We cannot improve unless you let us know where the shortcomings were. Going back to Mary's slide, right, about how the importance of, goals and metrics. Your feedback is incredibly important. So please let us know how we did. And I just personally want to thank you all for spending these past 3 days with us. It's not the same as being in the room, but I love seeing your comments come into the chat. I love the questions that were asked, and just thank you so much. And so now at this time, I will turn it over to Rebecca Kirch and Rebecca Angove to close out Patient Congress.
Thank you, Melissa. And it's so good to see everyone. You're joined again by the two Rebeccas, and we could not be more pleased or proud. And thank you for hanging in there, particularly through what has become part of the experience, the technical challenges that we had over these days. Your patience and your humor together with ours is much appreciated. Today was very energizing, and I want to close, and then I'll turn it to my dear colleague, Rebecca, as well. Echoing Melissa's thank you to all of you and our incredible staff who made this happen. And I do have to shout out to Melissa, who literally wove everything together to make this Patient Congress such a success, and the entire team and all of our faculty, but mostly to our participants that have hung in there at least perhaps all 3 days or today. We are so grateful for your committed focus in sharing sort of our work of the heart that really makes lives better for the patients and families that we all hold dear. That head, heart, gut that Martine talked about, that's what draws us all together. And I love the way that he said very sage words about what all of you do move us out of wonk wonk land and back into the real world of influential fire in your belly experience. And that's the place where real and great action happens. So without you, we would not be able to move the marbles, let alone the mountains that are coming with health needs navigation. So we thank you so much. We do thank all of our sponsors, including Bristol Myers Squibb, who is a late entering sponsor, but we're so grateful to all of them for what they've done to help support our event this week and in the coming years as we persist. I also want to congratulate Mo on her tremendous award. We could not be more thrilled, and for all of our volunteers, and congratulate my colleague Rebecca on the launch of the Institute, which she'll tell you a little bit more about as we round out today. So Rebecca, all yours.
Thanks, Rebecca. And I will not stand between the audience and their weekends for too long. Rebecca, you did such a great job of wrapping us up. I just want to echo everything that Rebecca has said and add that we hope that you continue to do the great work that you're doing, continue to partner with NPAF as a volunteer, with PAF as a volunteer, and then with the new Institute, there's going to be a lot more opportunities to engage patients and caregivers and bring that voice into not only the advocacy work in the policy world, but also research and healthcare transformation. So we're really moving in a great direction. Stay tuned, keep watching your email for announcements as we build out the Institute. We're going to have new partnerships, a brand new website coming, as well as continued projects that we're going to ask you to be a part of. And while we continue to be part of and partner with PAF and NPAF, the Patient Insight Institute will be the formal host of Patient Congress next year. Again, in partnership with PAF and NPAF, we are a tight-knit family, and we'll continue to do this work together. But you may see, a new logo or new branding, but it'll be the same Patient Congress, just bigger and better. So thank you so much for coming and spending 3 days with us. It's been wonderful. Fingers crossed next year we're doing this in person.
We do have regional rallies for those who want to have a final closeout with some of us. Melissa, you might know more about the logistics of what we have to do to get there. So please pipe in with what we need to do to make that happen.
Sure, happy to. And actually the link to the regional rally was just dropped into the chat. So you all can click there and we look forward to seeing you. We can actually see your faces there. So we look forward to you guys joining us and we can sort of have a more informal debrief of what your experience was like for Patient Congress. Again, thank you all so much. And congratulations, everyone, on a great 3 days. Thank you.
Thank you.